welcome to my channel Epitome of Creativity. So today we're going to study the femur, also called the thigh bone, and here is your thigh bone. So what we're going to first study, let's see the posterior and anterior surfaces of the thigh bone. Okay, this surface, which is smooth, is the anterior surface, while the surface that has some rough markings, and this surface is the anterior surface. Okay, what we just said, the smooth surface is the anterior surface, the rough surface is the posterior surface. Okay, so let's start from the anterior side. Okay, let's start from the upper superior structures. Okay, so this here this ball kind of surface is called the head of femur. Okay, what is it called? The head of femur. And you see this rough kind of depression, it's called the fovea for the ligament of femur. Okay, for the head of femur actually. Then we have these trochanters. These two are the trochanters, the greater trochanter and the lesser trochanter. Okay, the greater trochanter and the lesser trochanter. Then here, this surface here is the neck of femur. Okay, this part here is the neck of femur. And let's move on to this part. Basically, you see, this part is the shaft of a long bone, like the shaft of femur basically. And then here is these two are the condyles. Okay, these two are the condyles of femur. Okay, you see this rough surface, this is the nutrient foramen, through which bone gets its nutrients and blood supply and all that stuff. Vessels are passing through this. This is called the nutrient foramen. Okay, let's just revise the 3 to 4 structures that we just did. Head of femur, fovea for the ligament of head of femur, greater trochanter, lesser trochanter, nutrient foramen. Okay, neck of femur, and let's see some other structures. Okay, okay, you see this line crossing the greater trochanter, this line that crosses the greater trochanter and lesser trochanter. This is called the intertrochanteric line. Okay, what is it called? The intertrochanteric line. And oh yeah, I didn't tell you about this, that what is the anatomical position of holding the femur. Okay, basically this head here attaches to the acetabular fossa of the pelvic hip bone. It's like a rounded one. This forms a ball and socket joint with the hip bone. This femur bone forms a ball and socket joint with the hip bone. It is a synovial joint, and this has a convex surface. The acetabular fossa has concave surface, and they both fit together to form a synovial joint. Okay, and okay, so what is next? Yeah, to hold the femur, you see this ball, this should go on the medial surface, and this will go, the greater trochanter will go on the lateral surface of the body, because this is going to fit into the acetabular fossa, and this will go on the medial side, this will go on the lateral side. Is a bone of right leg. Okay, it is the bone of
holding a bone in its right anatomical position is very important, so hold it right. I don't have much space to show you its position on the screen, but head goes inside the body and trochanter goes outside the body.
Lower part of this femur. Here, these two structures you see are called the condyles. These side structures are called the epicondyles, and these are the condyles. Okay, this will be the medial epicondyle, and this will be the lateral epicondyle. Similarly, medial condyle and lateral condyle. Okay, and this, you see this surface here, this is a surface where the patella bone attaches, forming a knee joint with the femur. Okay, patella bone is a small bone that attaches in here in this structure, so we call this surface patellar surface. Okay, patellar surface. And here you can see a raised portion here. This is called the adductor tubercle. Okay, this portion here is called the adductor tubercle. Then we can also call this part here between the two greater and lesser trochanters intertrochanteric crest. Okay, you see this line here, you see this line here, this is the pectineal line. Okay, and it just traverses into the nutrient foramen, pectineal line, and this part here is the linea aspera of femur. And we talked about this surface called the patellar surface. We also call this intercondylar fossa between two condyles. Okay, intercondylar fossa. Did we just miss anything? And yeah, one more thing, this part here is called the popliteal surface. Okay, this is called the popliteal surface. We're done with this bone, I guess. Oh no, there's something left. Okay, you see this raised portion near the head of femur, it is called the quadrate tubercle. Okay, what is it called? The quadrate tubercle. And what's left? We're done with head, trochanters, the linea aspera, pectineal line, the nutrient foramen, the condyles, lateral epicondyle and medial epicondyle, lateral condyle and medial condyle, intercondylar fossa, then the neck of femur, popliteal surface in here. That's it for today. So if you want if you want to study about the structures of the femur in more detail, you can use KLM. I use KLM. I prefer it over any other book, but people say that BD is also a good book for it. Anyways, it was good having this bone in hand. It's kind of weird also. But anyways, we're done with the femur bone. Remember, posterior surface, anterior surface, okay? So we're basically done with this bone.
Just kidding. I'm not gonna hit you with this bone if you don't subscribe to my channel.
Bye bye. Have fun.
Lol, man.
Do study this bone properly from KLM if you want to. Anyways, it was fun holding this bone in hand, right? That's it. You got this? That's it for today, guys. Bye bye. Have fun studying this bone and anatomy, obviously. Take care. See you next time with another bone. It might be high hip bone. Okay, so keep waiting and I'll be updating you guys. Don't forget to subscribe my channel, or I'd rather hit you with this. And like if you like this video, share it with your friends who would benefit from it. And if I did miss something, please comment down below. See you next time. Bye bye.